up in the front.
Yeah, tighten it up. Come on.
Just maybe.
Tighten it up. We're all friends in here now. Okay, is everybody here? Raise your hand if you're not here. Raise your hand if you're here, but you're really not
The
here.
next 6 months will determine our break. Because they just spend
You're still really spread out.
like to start out.
All right, we're going to rap about Invisalign Go. Now, Invisalign Go is a new product for us that we're breaking out all over the place. It's really big in Europe right now. And the purpose of Invisalign Go is they created Invisalign Go to help with bringing doctors that have never done an Invisalign case up to speed so that they can do a case like, remember I was talking about this morning how like a monkey could do it? Because really they've taken all the predictability out of it and made it 100% predictable type green movements, we call them, that if the patient wears the aligner, they will be successful in having good orthodontic movement, right? Because like I said, the artificial intelligence, right? And like Travis is saying, all the algorithms, the software, because it's done it so much on 7 million cases, the software knows exactly what movements we can accomplish with 100% predictability. So when you do an Invisalign Go case, it's not going to qualify as an Invisalign Go case unless it is all green, 100% predictable movements. So you know that if you put a case in, like I'm going to teach you, and you do a case assessment, which in layman's terms this means like, let's give them pictures and a scan or impression, and let's see if the software thinks it's all predictable. And if the software gives you the green light, all you have to do is get the patient to wear the aligners and you're successful, right? It's way, way easier than it used to be when you and I started, where you would see a patient and they'd have moderate crowding or mild deep bite or open bite, and you said to yourself, I think I can do this with Invisalign, and you just went after it, right? So if I was to do that to you guys, you'd be like really hesitant on doing cases because you wouldn't know for sure if you're going to be successful having never done one before, right? So do you understand where the premise of this Invisalign Go comes from? Is that it ensures you predictable success based on the software analyzing the pictures, the scan, or the impressions. So when I say the pictures, the scans, or the impressions, believe it or not, you can take pictures of your patient's teeth using our photo uploader, which is, everybody know what the photo uploader is? Because I'll talk about it here in a second. But the photo uploader is an application that you can download on your iPhone or your Android or your iPad or your iPod. And you can take pictures. It'll walk you through what pictures you need to take. And then you can push a button to upload the pictures and ask for a case assessment. And it'll give you back a scorecard whether or not you can do this case as Invisalign Go.
By the way, all of your teams were trained on that in the comprehensive orthodontic records training that they went through this morning, so all of them already know how to do this.
Okay, so let's get into a little bit of Invisalign Go. So what is this product really all about? When we talk about describing what it can do, remember this morning I told you it's 20 weeks of aligners or less. Remember, it's not a product for, severe canine rotations or severe crowding. It's a product that is predictably moved that we know you'll be successful with it. So it's used for mild to moderate malocclusion cases, or if you're going to do some veneers and the teeth are not really where you want to do them because you'd have to prep them too much, you can do an Invisalign Go treatment just to get everything into a little better position. Sorry, I'm right in front of your camera. You can do a little better too.
You're the presenter. As long as I get you, it's fine.
So moderate to malocclusion or case setups or just social 6 the front teeth, this is a perfect product. up to 20 aligners, or translated to mean 20 weeks. It also only moves, like I told you this morning, second bicuspid to second bicuspid. You cannot move molars with Invisalign Go. If you have a patient that has a molar that needs to be moved, you cannot use this product, or you can use this product and just inform the patient or yourself that we won't be moving the molar. It doesn't mean you can't do Invisalign Go, it's just not going to fall in the parameters of what a typical Invisalign Go case is all about. It does accomplish arch expansion, and I'm going to show you to what degree here in a second. We use it a lot for pre-restorative anterior alignment, like I just said, so we're not over-prepping teeth unnecessarily if we're going to do crowns or veneers, right? And the other thing about it is that you get 2 extra sets of aligners when you're doing the treatment. Now, what does that mean, 2 extra sets of aligners? That means that if you accept an Invisalign Go case, and let's say they're on week 15, and all of a sudden they forget to wear their aligners for 4 weeks, as in they're not compliant, you are allowed to go back and send in new impressions or scan and get new additional aligners to finish the case properly. You can do that 2 times. You cannot change the treatment plan, and Doc, you know what I'm talking about, right? So let's say you put a case in and you wanted to do some movement, and then you got to like aligner 14, and all of a sudden you decided, wait a second, I think I want to do a couple of more veneers on this patient. I'd rather have the bicuspids in a little different position. You can't go back and change your original treatment plan. So when we say 2 additional aligner sets, that just means more aligners to accomplish the original plan, not more aligners to do a different ClinCheck. You see the difference? Okay, so that's kind of the basic overview of what Invisalign Go is all about. Green movement only. I want to tell you what, you keep hearing me say the word green. In Invisalign, we have 3 types of movements. Green is a movement that is predictable, like it's gonna happen if you wear your aligner. Blue is a movement that is intermediate, that you have to kind of pay a little bit closer attention to, make sure the patient wears the aligners, and you have to make sure that the teeth track. Black is a very difficult movement. You'll see like a black dot will be on the tooth in the ClinCheck if a canine has to rotate, say, more than 15 or 20 degrees, or if you've got to extrude a tooth more than 1 millimeter, or if you have to intrude a tooth more than 1 millimeter. All of these colors come back on your ClinCheck, and the teeth that have tough movements will have a little blue dot on them, or a little black dot on them. If they're green movements, there's no dots on them. So there's a little button when you get your ClinCheck back that says TMA. And TMA stands for Tooth Movement Assessment. So if you push that little Tooth Movement Assessment button, see where it says Tooth Movement Assessment button? If you push that little button on your ClinCheck, if it's a tough movement, it'll throw a black dot on that tooth or a blue dot. Okay? No Invisalign Go cases that are acceptable for you to do are going to have blue or black dots because they're all green movements, right? Okay. Someone asked me this morning, how do you know when to change the aligners and how much to wear them, right? If it's all green movements, like Invisalign Go is, you're just going to switch the aligners every 7 days. They don't need 2-week wear. No matter what, age, sex, race, anything, it doesn't matter. If it's an Invisalign Go case, they're wearing the aligners for 7 days and swapping every 7 days. Once you start doing other types of Invisalign, comprehensive Invisalign, like Doc is here, she's seeing blue dots and black dots probably all the time, right? And on older patients with blue or black dots, she might have her patient wear the aligner 14 days instead of 7 before changing.
Are we talking 24 hours?
So we're talking wear your aligners except when you're eating. I think we went over this in New Mexico, but the way you communicate, the way I communicate to my patients about aligner wear is you wear the aligners except when you're eating. It's optional whether you want to take them out for coffee, tea, or wine. If you drink with coffee, tea, or wine, it's not going to hurt the aligner, it just may stain it or make it a little cloudy. But then again, we have crystals we give them to clean them, and you can buy Retainer Bright tablets off Amazon Prime and they can soak them while they're having dinner. It's not really an issue to drink coffee or wine with aligners. But if you tell a patient to wear their aligners 21 hours a day, they're going to cheat on the time. They're going to be like, wait, I worked like 21 hours yesterday. I'm only going to wear it 17 today. But if you just make it like wear your aligners except when you're eating, it's good. Because no one eats more than 4 hours a day. Except my homeboy there.
Keto, baby, all day.
Keto all day. And then, so how are you telling your patients to wear their aligners? What's your rule?
I say eat, clean your teeth, put them right back in.
What was that?
Eat, clean your teeth, put them back in.
Yeah, so she's doing the same thing. And most people are doing that. We used to teach wear your aligners, 20 to 22 hours a day. People cheated on it. So if you just keep it simple, like wear them except when you're eating, they do it, right? Okay, so let's go on to a little bit more about Invisalign Go. These are the movements that you're kind of going to see able to do with an Invisalign Go case. So if you want to know like how much spacing or crowding you can resolve with Invisalign Go, you can see it's about 7 millimeters or less. What does that mean, 7 millimeters? What does that mean? If they say we can fix 7 millimeters of crowding, how do you know what 7 millimeters is? So you can visually look at front teeth that are crowded and how much the teeth overlap each other. You can see like that one's overlapping 1 millimeter. This one's overlapping 2. That one's overlapping 2. You can add it up, and if it's under 7, Invisalign Go case assessment is probably going to be acceptable, right? If you got so much crowding that you've got 10 or 11 millimeters of crowding, the case is not going to be acceptable by Invisalign Go. Same thing with expansion. So expansion means like how wide can we move tip those teeth out posteriorly to get the arch wider? It's going to basically allow you in an Invisalign Go case about 4 millimeters. And really what that means is like 2 millimeters on both sides tipping out, right? And if you expand an arch 4 millimeters, does anybody know the mathematical formula that gives you way, way longer arch length? It's like pi r over c squared. Who knows that?
E equals MC squared.
What is it? E equals mc squared? But my point is that as we expand about 1 millimeter or 2, we gain almost twice that in length. So you don't really need to expand a whole bunch, right, Doc? You don't need to really get super far out there to gain a lot of space to resolve crowding and to harvest space to align your teeth. Deep bite and open bite corrections less than 5 millimeters. And what that really means is they're probably like, relatively tipping the teeth out to get a little bit of relative extrusion, and they're probably intruding or extruding in maybe a 0.5 millimeter to 1 millimeter. But the combination of both, if you do a little bit on both arches, you can gain a lot of deep bite correction or open bite correction. We can move midlines about 1 millimeter with Invisalign Go, and we can extrude or intrude 1 millimeter to 2 millimeters. This is the range of movements that you're going to be able to do. Do you have to know this? No. Do you even have to understand this? No. All you got to do is look at a case assessment and it says green go, hand them aligners. A monkey can do this. Any monkeys here? Okay, case selection. Remember I told you the case selection was a huge, big deal for us. We used to always have to spend hours on teaching you guys case selection, what not to treat, what to treat. Now, it goes all by the wayside because Invisalign Go is going to do it for you. But if you look at that right there, it's basically allowing you to do either a set of pictures, either do a set of pictures or impressions and mail them in, or a scan to get an assessment. So we have 3 platforms that you can utilize to get an Invisalign Go case assessment. This platform right here would be done with pictures. So if you download the photo uploader, the Invisalign photo uploader, has anybody downloaded that on their phone here? Dr. Pope has it? Anybody else? You have it on your phone? Oh my God, you gotta get the photo uploader, girl, come on. So the photo uploader allows you to take pictures. And by the way, all your staff learned how to do it this morning while we were over there. So if you need to take Invisalign pictures, do a case assessment, let your girls do it. You don't need to do it. Okay? Say okay.
Really?
Yeah.
I'm not a doctor. Okay.
But basically, this is what the photo uploader looks like right here.
It actually worked well. I did it and it worked really well.
Oh,
I was surprised how
it's
well it
crazy.
worked.
I mean, it kind of blows my mind that you can take these pictures and they can tell you if it's an Invisalign Go acceptable case off of pictures with algorithms. It's pretty mind-boggling. The other way, like I said, you can do it is by doing a scan and getting that submitted. And when you get a case assessment back, we'll go into this further, but this is what they look like. So if Dr. Pope was to take his phone and take pictures of you, 8 pictures, and push a button that says upload and do case assessment, in a matter of like 2 minutes, he would get back this. And then he would look at it and it says Invisalign Go treatment recommended. So he knows that all the movements of your teeth are green movements, easy, acceptable, and can be accomplished in 20 weeks or less. Where's the grief? It's pretty amazing, yeah.
Real quick, on the photo one, how do they account for an anterior implant?
You have to tell them. I'm going to show you when we do the prescription how you tell them that.
All right.
Great question, though. Any other great questions?
I've got plenty of them.
Okay.
You guys must be related.
We'll come back on this.
Oh, they are.
And you can also see if Dr. Pope took her pictures and she had some stuff that was not green movement, it was blue or black, then it would come back and say Invisalign Go, treatment possible or not recommended. In which case he could push that blue button up there and refer it to himself and treat it. But you guys that's one thing you guys need to do in here is that there are doctors here that have done a number of Invisalign cases. She's done, you said like 300, you've done some, right? Who else has done some cases here? Are you just doing wires and brackets?
I'm doing wire brackets right now.
Okay, you gonna get into the 2019 era?
Yeah.
He's actually learned his
Come on out of the cave.
He just got his liners yesterday.
Come on out of the cave.
Liners yesterday.
Yeah.
Yeah, and your patient can go like, why are you putting me in wires and brackets and you have Invisalign?
That sucks now.
I'm wear them too.
And you should always have someone in your office in aligners, right? I always have a staff member, a hygienist, an assistant, someone in the office always in aligners, because they can be your guinea pig. Like if you're doing a hygiene exam and the patient goes, well, what do they look like when they're in, or how do they feel? Jennifer. Model, right? You ever have patients in your office? You have staff in your office in aligners? Treat all your staff with Invisalign. It's a good thing to do. It's good